Welcome everyone to the Living Strong meeting. Tonight, we are so honored and thrilled to be hosting Linda Ann Kahn, who is a CLT, LANA, CDT, and NCBTMB certified. She's presenting essential oils to the rescue this evening, and we're going to learn from a passionate clinical aromatherapist about how you can incorporate aromatherapy into your lymphedema treatment plan and enhance the quality of your life. As usual, the following information is informational and for educational purposes only. Before making any changes to your lymphedema treatment, you need to seek your own trained medical professional, whether it's your doctor or your CLT. You need to get clearance and sign off from them. We're merely presenting information to serve as a guide for you, and it's not supposed to be construed as medical advice. We are recording this session. We do have some Living Strong members on this call. So we will be presenting the information, and at the end, we'll have a Q&A, but the recording will end before the Q&A starts. So without further ado, go ahead, Linan.
Well, it's an absolute honor to be here. I've been following you for a while, and I'm so excited that you have this beautiful community to help everybody. And my goal since the very outset when I became a lymphedema therapist was always to be of service to my patients and to other people. I help people all over the country, all over the world, as much as I can, because we're all in this together and we have to help. I just shared with Veronica, I actually have lymphedema and was diagnosed in 1992 when I was graduating in Austria as a lymphedema therapist. And so I understand what it is with compression and garments and watching and nutrition and all of that stuff. So I know that, and I've been working with patients now for nearly 30 years. And I do work with a very, very comprehensive program. And so we integrate many, many things. But today we're going to talk about aromatherapy. So I thought I would just share my screen just for a little bit. And where is it now? It's not coming here. So maybe I'm not going to be sharing the screen. Just let me find it. Just let me look one more time, because I know that I had this already here. PowerPoint, it's right here. Okay, so let me try again to share the screen.
Perfect.
Okay, but now you're on my email, so okay. Oh dear, too many things that were open here. PowerPoint. There we go. That's it. Can you see my screen now? Okay. Okay.
Yes, we can see.
Okay, perfect. So we're going to talk about aromatherapy for lymphedema. So I first wanted to talk to you about what is aromatherapy. And I know that many of you are working with essential oils, and essential oils are really powerful, and they are the life force of the plant. And they are hidden in the plant. That is an essential oil of lavender in the lavender plant. And that's a microscopic view. So they are actually in the plant, and they come out to help the plant, protect the plant against parasites, against excess water, excess heat. And many of them are antimicrobial. Some of them are antifungal. Many of them are antiseptic and help with the emotions. And just as they work in nature, so they work for us. We take these oils and they each have different properties, and we help them. And so today we'll talk about how they can be used for aromatherapy, for lymphedema. And as I was saying a little bit earlier before we started, aromatherapy, lymphedema, there's many aspects to lymphedema. There's the physical, working with your lymphedema. Sometimes there can be infections, there can be inflammation, there can be some pain, sometimes irritation, and other things can be the emotional aspects of how we are dealing with the lymphedema. So a lot of times there's a lot of stress involved around this. And so as we inhale the essential oils, the molecules go through your nose, through the limbic, into the limbic system of the brain. There are little hairs in your nose called cilia, and the essential oils go right into the cilia where there are different odor receptors and go through your olfactory epithelium where there are 20 million nerve receptors. And then it goes to the limbic system of your brain where it will trigger thoughts, feelings, memories, and emotions. So odor has a really powerful effect on our being. And actually, from the time you smell an essential oil, within 5 minutes, it's in your brain. You can change the chemistry. You can also work on hormones and work on so many aspects just by inhaling. And so that's what this shows you here, that when you inhale one simple aroma, it has an effect on the brain and this chemical reaction takes place. So the brain waves are affected and it can cause you to become euphoric, hungry, sleepy. We call this psycho-aromatherapy. And so we know about the treatment of lymphedema, which is the complex decongestive therapy, working with manual lymph drainage. I have added a few components, deep breathing, and of course we have the compression bandaging and skincare, which we can also use essential oils, an anti-inflammatory diet, which is not on for this particular talk. And then I have added to the CDT, which is the complex decongestive therapy, which is our standard care, aromatherapy, because we can work with the oils for skincare, for anxiety, stress reduction, sleep. Sometimes you might not be sleeping properly, lymphatic flow, infection, pain, and more. And I'll welcome your questions about any of these things as we go along. And so the goal of our treatment, always with lymphedema, we want to decrease pain and hypersensitivity and reduce inflammation. We can do this with oils. We want to improve the lymph transport capacity. We want to boost the immune system, reduce the edema. And with lipedema, there's a lot of bruising that takes place, and we want to increase the microcirculation. And so when I use essential oils, when I do my manual lymph drainage, I incorporate essential oils. And you can do that too at home. So there are oils that help to boost the immune system, like lemon and bay laurel. And bay laurel can actually be put directly on the lymph nodes. Usually we do not put essential oils directly on your skin. You blend them, and we can talk about this a little bit later, but usually you will use about 12 drops of essential oils in about half an ounce of a carrier oil, which could be fractionated coconut oil or sweet almond oil, or there are other more specific oils for different conditions, but those are the basic ones. So bay is an exception. You can put it on the nodes if your nodes are aching. If you have lymphedema of the leg, sometimes those nodes in the groin area can ache. I have lipedema and often my nodes ache. You can put bay on just to help with that. And then you can add oils for the nervous system, like Melissa. Melissa is a very expensive oil, so you can buy it in a carrier oil of base of jojoba. Melissa is lemon balm. And then Roman chamomile. Those two are nervines, so they help calm the nervous system. So they're really good to help you with sleep, or if you're feeling really stressed or anxious. And different stages of lymphedema or different times that you're going through, you may feel more or less stress. Maybe there's a function you need to go to and you're not feeling great. Those are great oils to do. And then pain. Sometimes there's pain. And it can also come because you're not walking properly, because your leg might be too large or your arm might be too heavy. And the way you're not standing properly, and your muscles will go out of alignment. Peppermint is wonderful for pain, also for headaches, and sweet birch, but sweet birch has to be used very, very low amounts because it can be toxic if used too much. When you've used camphor or you use some of the things in the drugstore to help you with pain. There'll be sweet birch in it, and you've got to be careful because it's very, very strong. There's an oil I like called Ply, and another one called Copaiba. Copaiba is anti-inflammatory, and it helps with pain. And then we spoke about stress. Melissa, of course, lavender. Lavender is really good for the immune system. It's really good for burns and for infection and for calming the nervous system, and also to help you to sleep. And bergamot is another one that helps with that. And then for lymphatic flow, you can make up a blend. I have a blend called Flow. And in the Flow, I have cypress, grapefruit, lemon, rosemary, orange, and lime. All the citrus oils are really, really good for your lymphatic system to flow. And peppermint it actually has what we call lymph motor angioricity. It causes the pumping action of your lymph vessels. So it helps it to flow. These are just some oils that I just thought I would share with you that are good for the lymphatic system. And maybe you have some of these or you don't have others. Sometimes there's substitutes you can use as well. Angelica is a beautiful oil to help with the nervous system and also improves lymphatic drainage. And it comes from a root. And typically the oils that come from roots will be grounding and centering and also move the fluids. So that's a good thing to do. And it also helps to detoxify. And then bay laurel, we already spoke about that you could put it on your nodes. It's a great immune stimulant and regulates the lymphatics and the lymphatic nodes. And it's also an immune stimulant for colds and flu and viral infections. So we want to look at that too. Essential oil of cedar, together with the angelica that I spoke to you about, are antimicrobial and anti-inflammatory. There are oils that they have chemical components in them, and monoterpenes are really good for the lymphatic system. And then we have cypress, which comes from the tree. It's a tall tree, and cypress is what we call vasoconstrictive. So if you have problems with veins together with your lymphatic system, with your lymphedema, the cypress is really great because it will constrict and decongest. Also great for the circulatory and the lymphatic system and helping with edema. And it also helps to stimulate the chi energy of the body. So we work on all levels. We want to work on the physical aspects, and then we want to work on the emotional aspects, or to help you with your energy. Another one that I love is juniper berry, and that comes from the berry, and that's detoxifying and cleansing and really, really good for the kidneys to help detoxify. If you have kidney disease, you don't want to use juniper berry. But if it's just edema and lymphedema, the juniper berry is really good. And we can talk when we share about dry brushing, because I teach all my patients how to dry brush. And you can also do essential oils first and then do the dry brushing. And we dry brush in the direction of lymph flow or redirecting the fluids away from the area. If you have lymphedema of the arm, moving away from that area across, or if you have lymphedema of the leg, moving up above towards the arm. And we can talk about that if you want to. Grapefruit, I was on a panel just recently and I was asked what is my favorite oil to use for the lymph system. And I always grapefruit, because grapefruit really moves the lymph and it helps with fluid retention. It's a great lymphatic stimulant, and it also uplifts the spirits. So we want to always help to uplift our spirits at the same time as helping our lymphatic system. So grapefruit is one of my favorites. It's not a very expensive oil. It's easy to get. It's not one that is adulterated. Some of the oils are not 100% pure when you get them, but grapefruit is wonderful. And then lemon helps with the immune system. because it increases lymphatic circulation and also produces leukocyte formation, which are white blood cells. So that will boost immunity. Lemon also helps you with concentration. If you have brain fog, a lot of my lymphedema patients do get some brain fog. So if you have lymphedema and you have lymphedema with the lymphedema, you may have some brain fog. The citrus are very uplifting and help the brain to, help you to concentrate a little bit more. And then bergamot, lemon, sweet orange, and cypress, those are great in a combination because they're antiseptic and antimicrobial and antibacterial. I don't know if any of you have lymphedema, but we can talk about that. And then for lymphedema, we boost the immune system. We want to help with lymphatic flow. We want to help with any inflammation. We want to help with circulation and then emotional support. And so I'll just repeat again, when you're making a blend, usually, and this is an average for an adult, not for a child, and for a normal skin, we would use an average of 12 drops of essential oil mixed in with half an ounce of a carrier oil, like sweet almond oil. You don't want to go too strong. You don't need to. We really work in a homeopathic way. And I know that a lot of the multi-level companies are telling people to put essential oils directly on the skin, put it under your tongue. We don't recommend that. I am a clinical aromatherapist. I actually just presented at Botanica 2020, which is a huge aromatherapy conference. It was supposed to be in Slovenia, but we did it we did it live, on virtual, and we were talking about all of this at the conference. So you really want to, I lost what I was saying now. I'm thinking about the next thing to do. But we want to boost the immune system and help with lymphatic flow and help with inflammation. Oh, we want to make sure that we are blending correctly. And then you don't have to be afraid of essential oils. And you don't just put them under your tongue. When you are pure clinical aromatherapist, we work very carefully with the oils internally. I have studied aromatic medicine and they can be used internally, but I would urge you not to do oils internally unless you are working with a professional. And in truth is, you really don't need to, because applying them to your skin, you're getting so many amazing effects, and you actually avoiding the liver by doing that. We've all seen lymphedema after breast cancer treatment, and then there's radiation burns and scar tissue from the surgery, and then lots and lots of emotions. Maybe some of you can really identify with that. And so we work with essential oils because the scar tissue can limit the lymph flow. And so my favorite is to use helichrysum essential oil together with lavender. And there's a specific rosemary called rosemary verbenon. And then these are other carrier oils that can be used. Calophyllum, which is also called tamanu oil, which is very anti-inflammatory, and vitamin E, and hazelnut, that can be put over the scar tissue. But the scars must be closed. They cannot be open at all. You have to wait until they are closed, and then they can be massaged in. I teach my patients how to do a scar tissue massage and work with the oils, and then we can help to reduce the scars. And then we want to also work with the emotional aspects of the scars. So we want to boost our immune system. We want to boost our whole nervous system and heal our scars and know that we can move forward after surgery. And then we can increase the circulation. So you can also massage frankincense, grapefruit, and lavender, again blended in the carrier oil. If any of you have aloe vera, you can also use aloe vera and add essential oils to the aloe vera, particularly if the area is hot and warm. The aloe vera is really cooling, and then you can blend your oils into the aloe vera instead of into the carrier oils. And I'm just going on. So tell me when I've been speaking too much and you want questions.
That's actually a great segue because we're almost at the 15-minute mark. So I'm going to go ahead and interrupt you here so we can start our Q&A with the members of Lymphie Strong who are on the call. I do have three questions here that were submitted in advance. And before I stop recording and go to the members, I did want to ask you this general question because I think it's one that others might ask. And I was wondering if you could add any essential oil to your hand sanitizer. So during the pandemic, many people are making their own hand sanitizer. And so I thought this was a common question that people might ask. What are your thoughts on that?
So our Aromatherapy Association did pass out that we shouldn't use essential oils because it should be exactly what the CDC has said. Having said that,
there's always a caveat, right?
I just couldn't resist. And I was at a family wedding yesterday, COVID, 12 people at the wedding. My niece got married. And I gave my mother some sanitizer after we went to the restroom. And she said, oh my God, it smells so lovely. And so I added some essential oil of tea tree and thyme into it and a little bit of lavender. And the thyme is antimicrobial. And I put a little bit of lemon. And then I made it exactly the way the CDC wants it. And I do put a little bit of, what do you call it? That I put in to make it soft. I can't think of it anyway. Yes, so yes. So that's the answer. Two different answers.
Okay, so with that, I will close the recording session of this Zoom call. Thank you so much for joining us, Linda Ann. It was such a pleasure and honor having you here today. Thank you so much.
It's a pleasure.